COPD is one of the top 5 causes of death in the U.S.
In this week's Medical Moment, we look into the best ways to treat it.
Dr. Jason Biehl of Spectrum Health says chronic obstructive pulmonary disease is an umbrella term for chronic bronchitis and emphysema.
And that involves inflammation of the airways that inhibit patients' abilities to exhale, and also involves destruction of the alveoli, which are the air sacs of the lung, which can limit the ability to exchange gas like oxygen. It can cause wheezing, symptoms of chest tightness, cough that can produce sputum, and chest congestion.
There are many causes, but Dr. Biehl says chronic smoking is the #1 cause, and COPD usually presents itself later in life.
Unfortunately, it is an irreversible disease, and so we can't reverse the damage that's been done to the lungs. Our goal as lung doctors is to maximize patients' breathing quality of life.
Dr. Biehl often sends his patients to what's called pulmonary rehabilitation,
where you go and exercise under the watchful eye of a respiratory therapist, and they teach you techniques of how to breathe to limit your symptoms of breathlessness and allow you to strengthen your muscles so that you are more conditioned and you get breathless less easy.
Another tool in the battle is the usage of one of 2 types of inhalers.
One is a maintenance inhaler that you take every day, regardless of how you feel. And those are usually twice-a-day medications in the morning when you wake up, in the evening when you go to bed. We do have what's called rescue inhalers, and those are the ones that you would carry around with you that kind of help open the airways up in the short duration so that you can feel better in those times of breathlessness.
Dr. Biehl says if patients don't understand their disease, they can actually make it worse.
When people get breathless when they exert themselves, then they won't exert themselves because that's a really anxiety-provoking symptom. And if you don't exert yourself, then you can become deconditioned, which can only worsen your symptoms of breathlessness.
Valid point there. For more information on scheduling an appointment, you can call the phone number or go to the website right there on your screen.